my name is Anadi Gupta, and I am going to be your host and partner for this pre-event series from Kanyathon on child rights awareness. I
Good
bring to
evening.
you I bring to you the sixth session of a virtual wellness series called Health Shots. I am from Team Kanyathon, and I think knowing about child rights is very important for us in order to be better and spread awareness regarding it. And that's what today's session is all about. Now coming to the
बोलना
everybody, please mute yourself. So now coming to the star of the day, Ms. Jenishiya Priyanka, who has 11 years of work experience in the social development sector, specializing in child rights with specific focus on child protection. With an education in MSW from Bishop Heber College, she has vast experience in results-based management system, program management, and strategic planning. In her current role in CRY, she provides strategic guidance to the program team for effective planning and implementation on 5 thematic areas, which are child health and nutrition, education, protection, and participation. In the past years, she has supported CRY in preparing log trains and survey tools towards increasing the effectiveness of programs in the organization. In addition, she conducts and supports evidence gathering exercises and research studies to aid in advocacy efforts. I would like to heartily welcome you, ma'am. I would really like to welcome our audience to our session. We have friends and family of our students, and we also have with us our corporate friends, Asher, Tinkan, and Sejunuti. I would like to thank you all for joining us in this enlightening session. I also want to thank our corporate sponsor, Brillo, who is in the noble cause of providing STEM education for the underprivileged girls, EGOS, who will provide nutritious breakfast on 12th of March, Elicita for providing us the venue, and Red FM for being our radio partner. To maintain the session's decorum, everybody has been put on mute. In case you have any questions, please post them in the chat box. Now I would like to start the session now. Can I? So, ma'am, there are some questions that we would like to know about. And the first one is, what is the current state of child marriage in India and South India, and how in CRY you are looking towards resolving the issue?
Thank you so much, Anadi, for I think a very good introduction, and it's really a great pleasure to be part of this group. And I know this team, I don't know how many of you are new, but some of you already may have had some experience working with CRY. So any questions that you have, of course, definitely please do ask, and I will try my best to answer how much ever, to bring some clarity on child rights, on the issue of child protection itself. And yeah, Anadi, coming to your first question on child marriage. So I think child marriage basically is an issue that is so widespread, not just in India, but world over. And we do know that this particular issue of child marriage, especially, it's tied a lot to the socio-economic, lower socio-economic strata of the society as well. And therefore, it's more rampant in underdeveloped or developing countries. And India is also a huge contributor of this issue, unfortunately. And if you look at it, just a few numbers for us to understand the intensity of the problem itself. In the very latest NFHS 5 survey that the government of India had conducted, over 23%, women are being married before the age of 18 years. So, 23% would be more than 3 million children who are actually in this situation. And child marriage, as it is not a standalone issue, as we all know. It leads to so many other difficult situations. And while the national average itself is at 23% of the survey is usually done among women who are 19 to 24 years. While that is the 23% is the national average, there are states which have more than 40%. You have states like Bihar, Jharkhand, which are over 40%. And even within South India, if we look at the situation, it's still like you have Andhra Pradesh, which, and South India is actually shown as a as more developed when compared to the rest of the country. But even here, if you see, it is higher than the national average, where we have in Andhra 29% of girls getting married before the legal age. And similarly, in Karnataka, it is 21%, and in Telangana, it is 24%, with Tamil Nadu at 13%. So these are not small numbers, and we are seeing a huge number of young girls, children who actually have their rights being deprived in such difficult circumstances. And we at CRY, we are working with at different levels to kind of stop this issue. And we are working at different levels, from starting right from the child level to the community, and also working along with the government systems. So as we know that there is a law, the Prohibition of Child Marriage Act is there in place, but in spite of that, there are so many other issues. Child marriage, especially being a social phenomenon, it is a social issue, and therefore to bring about a change in the knowledge, attitudes, and practices of families, of communities, and so many other factors, external factors that are contributing to this, have to be tackled at. And at CRY, when we are looking at resolving the issue of child marriage, or to prevent child marriage cases from happening, we have seen that a huge factor is also the lack of access to education. So when children are not having the access to continue their education, then automatically a whole cycle kicks off. And when parents are concerned for the well-being of the child, protection of the girl child, then automatically child marriage becomes, that comes into play. That is seen as immediately the first option that families go to. And therefore, in order to prevent this, then to counter this also would be to make sure that all children have access to education. So I think that is one of the critical factors that CRY is working on, to identify those areas where children are struggling to go to school. So there are so many areas. While we have our RTE Act ensuring free education for all children up to the age of 14 years, the most number of child marriages are happening after that age. So when children are not able to then access high schools or higher secondary schools, then that's where the high number of dropouts then again happen. Enrollment of children from the 6 to 14 years age group is a little more comparatively easy because of the access to schools. But once you've completed your 8th standard and you have to move into 9th standard, and then if there is no school nearby within a kilometer or 3 kilometers, and then when the girls have to travel, you have to either go by bus or you have to walk through difficult pathways. These are all major barriers. And there are many safety issues there again happening, which again becomes a whole cycle of protection issue. And therefore then also to only work with the parents, just only to create awareness about the ill effects of child marriage also wouldn't work that much. But it will have to be combined with the work with the systems as well, to ensure that whatever right the child has, it is a child's right also to be in a safe space. And for that, CRY is working through all our partners. So CRY works in 19 states of the country. And as of this year, currently, we are working with over 117 initiatives, projects that we are supporting. So, we work with all of these on the ground partners to work on all of these child protection issues that we are looking at, and to ensure that children are safe from marriage. And recently, we have in the past year alone, we have been able to avert more than 4,000 child marriages. So that is, while when compared to the intensity of the issue, it still seems like a small number. There are so many children who are still slipping through the cracks, but still, at least to ensure that these 4,000 plus children this year that we've managed to avert, will at least get an opportunity to continue their education and be safe from protection issues. So this is something that we're working at. And any questions on this, Anadi, I would be happy to take, or I could continue some more also on this.
Yes, ma'am. As we talked about child marriage, one of the bigger issue is female feticide. And
Yes.
how is it still being carried out, and what are the measures that government is taking to eradicate it?
Yeah, female feticide, again, if we look at it, this is an issue that is, again, not something that is very talked about. It is an issue which is buried a lot under the carpet. It is not something that, as a country, we are proud of as well. And therefore, instead of addressing the issue, there is a lot of also sometimes an effort to kind of brush it off, that this is not something that happens. And this kind of abdication of responsibility by all concerned, actually would kind of aggravate the issue even more. And this stems, especially if you look at female feticide, it stems from uh, a very basic uh, patriarchal notion that there is the value that is placed to girls is much lesser than to boys, and therefore the need for uh, having boy children, male children, because they add more value to the family, or when that kind of a situation is seen, then automatically what happens is, girls are seen as that you have more responsibilities, you are demanding upon the family, and therefore you have to spend so much for the child, for the girl to get married, in terms of dowry and so many other things. And therefore, to do away with girl children itself. If you look at our child sex ratio, India is at 929, and there are so many states where it is we are still at a 780, 800. So it's such a dismal situation. So that itself, child sex ratio itself, very clearly shows us the issue. If where are all these girls going, then where are all these missing children? And there is a need to look at this issue. And again, here there is an act. So the PCPT and the Act is also there to make sure that there is a prevention in identifying the sex of the fetus before the child is born. But there are many other ways in which, even whether it is identified that it is girl or not, but to abort the fetus. So there are efforts being taken to do that. And we work in CRY, we work in Salem, Salem in Tamil Nadu. So in Salem, we work with a project that works specifically on female feticide. So our experiences here in the past over 10 years has been that uh, to work again hand in hand both with the community, to work on their to build awareness and to work on their knowledge and practice and behaviors as well, and also to work with the government systems to ensure that there is a proper implementation of the act as well. Because this is also the one thing that we noticed in Salem while we were trying to understand what is the root cause of the situation, where is it coming from. While there is a within the community, the importance given to the boy child is more, but then again, what is it factor that is helping the situation, making it dire? Actually realize that there are many scan centers, unregistered scan centers in fact, that are functioning, where which are still revealing the sex of the female child. And there are tie-ups with pharmacies and these centers, where women are just being sent to these centers and then back to the pharmacy. So that tie up also is something that there was there. And some 5-6 years back, we had also did a big crackdown with the help of the press. In fact, a media sting operation kind of thing was done, and then identified all these scan centers, and they were closed down. But then, as we all know, it doesn't stop there. It is a regular work in progress. While those centers may have been shut down, again we were able to see that they were mushrooming up in other places in some other name. And therefore to completely remove that issue is again a little more difficult. And unfortunately we saw that after COVID especially, also there is a pattern emerging that there are more tablets, there are more pills that are available in the pharmacies itself, where you do not even have to go to a scan center, and you don't have to do the abortion. So you can just get these pills, and then the fetus is aborted. But then again, there is also a very interesting phenomenon we notice there, where community members, as in many places, every family goes to an astrologer for any good or bad in the family. And so there are many of these astrologers itself who kind of say that, if, only your sixth will be a male child, and therefore all the other five will be terminated, the pregnancy gets terminated. And we all know what it does to the, forget the case of the missing child, but what it does to that woman's body as well, both physically, emotionally, mentally. So these are certain things, but then those patriarchal notions are so inbuilt that for all of us to firstly understand where it is coming from, and to start working on it is actually quite difficult. So CRY, what we have done, especially in this project, is we have taken it step by step, where we've started working with the community firstly to build their trust itself. Because these are very sensitive things that you just cannot go in and work on. It's very family based, it's very personal, and therefore to work with them that we are doing this for your own good, to bring that kind of an awareness and to make them understand the rights of children, especially that girls are not a burden, or to bring that kind of an equality thing as well. So we've been working with the communities, and that has been very positive impact. And earlier that used to be, when I say earlier, it's just as early as just 10 years back, 8 years back, you had these midwives, or untrained, not trained, not professional, untrained dais who would be in all of these villages, old, really old women who would be at home doing all of these, giving at home remedies or whatever to terminate the pregnancy. And we were able to, in all the 30 plus villages in that district that our partner was working in, they were able to make sure that in the next 2 years, there were no dais who were doing this termination at home. That all pregnancies in the beginning itself, immediately when the pregnancy is identified, it is communicated to the Anganwadi worker, and they are registered to the health center, thereby preventing so many maternal deaths as well, because it starts affecting your health so much. And by the time before you even reach your health center, then there are so many cases that happen like that as well. So we have been able to ensure that at least people are receiving support. They are going to healthcare providers now, instead of resorting to homemade just home support and stuff like that. So there is this positive outlook that we are able to see, while the numbers still aren't, because we are still working on this, and impact or any kind of long-term outcome that we can see in this will take a long time. And therefore we are just cultivating that change in the mindset, working with them to make sure that there is some kind of a change. If we look at it, in the beginning, when we started working in this particular district especially, there were over 60% uh, mothers, or pregnant women who were terminating their pregnancy. In 5 to 6 years, we saw that number came down to almost 25% or so. And then again, in the past 2 3 years, it came down to as less as 15%. But then unfortunately again, COVID hit, and we all know that so many issues happened during COVID, and all the progress that was made in terms of all these social indicators actually took a huge hit. And then we've gone back so many years, unfortunately, and therefore this work will continue. But however, when with CRY, we have with this particular partner especially, we have developed a system wherein not just once you come to know of a woman who is reaching out to an astrologer or to a scan center, but then to right from the beginning identify those high risk families, which is families which already have two or more girl children, and therefore because then the likelihood of them aborting so that they can get a male child is actually much higher. So to keep a track of them, to work with them closely, working with the Anganwadi workers to ensure that the village health nurses are regularly going for their visits, making sure that they are identifying those families, and they know that when a woman is pregnant they immediately need to be registered. So this is some work with regards to female feticide we've been doing. And we are trying to do certain surveys also to identify in other pockets, in different other pockets in South India itself, if this issue is persisting and how do we work with it. But like I said before, it is a long journey. It is a long journey. But then female feticide itself is one of the very, I think, crude ways of it's very crude, and it is extremely sensitive as well to work with the community. And therefore while this again, there is a huge misconception that this happens only in rural areas, but we have seen studies, national international studies, that say that this is a global phenomenon as well. But then to also take the messaging across, to take the message across of all the health related issues that this brings about, and a whole shift in mind space itself of the to just break the notion that girls are as important, and it is not you can't just take away a life like that. So that is also something that we are in CRY working on.
Yes, ma'am. I think it is a very big step from CRY's side, and we are sure that it will create much bigger impact.
Thank you so much. I think again, Anadi, in the right, while we talked about two issues, which is child marriage and female feticide, uh, I think the health related issues in these both are very interlinked.
Yes,
That is something that we have been able to see, because this holistic approach of not being not taking one issue separately, but how this is linked to everything else, that is something that in CRY, in our experience over the past many years, we've been able to see, especially linking, I think, child marriage to malnutrition. So again, malnutrition is a huge issue that we have been seeing, and in CRY we have been working on it. Is one of our major goal areas as well. And here also we are seeing that girl children are affected so much more. That when a girl is married so young, before the age of 18 years, then the chance for teenage pregnancy is higher. So we recently actually in 2021 did a study, and found out that of the women who've been married before the age of 18 years, more than 59% of them got pregnant also before 18 years. And therefore then this early pregnancy then leads to a whole lot of issues, where the infant itself, the fetus itself, is not properly fully formed, and then the nutrition that it has to receive is not received, because the girl herself is actually in a very fragile state. And anemia itself, if you look at our own the NFHS 5 data, anemia it's just so rampant that if you just take one state, if I'm just going ahead with a state like Tamil Nadu, which is considered to be high in all its social indicators, here itself, while 25% of the 15 to 19-year-old boys are anemic, 53% of girls in the same age group are anemic. So here itself you can see the divide between girls and boys, unfortunately. So this is a huge thing, and when the young mother is anemic, automatically then that transfers to the child as well. The child is not going to be as healthy. And then when with the uh, lowest level of socio-economic status, then to also have the level of nutrition then. Right? That is also an issue where we are seeing so many stunted, wasted, underweight children. So there is underweight is again a huge issue where we are closely working with uh, the Anganwadi centers and also with the health centers, the sub health centers, the primary health centers, to make sure that the children get their nutrition at the same time are also immunized. Immunization also is something that CRY is focusing on, making sure that age appropriate immunization happens, because this is something also we have felt that there is sometimes a misconception about certain vaccines, about getting vaccinated, and also that if you miss a vaccine, then again do you again go back and get it? It sometimes becomes a missed vaccine, and therefore the susceptibility to those diseases are then much higher. But then this also becomes an issue where we've seen that the family, the mother has to leave her one day's work if she has to take the child for immunization. So that is a very real issue where while we can give all the awareness that we want, but then who is going to pay for that one day that this the parent is losing to be taking the child and going to a health center and getting immunized and come back. So that is also an issue that is huge. While the government has already taken certain initiatives with village health nurses going to the houses itself to do their immunization, but still there are many practical issues there. And therefore immunization is again also something which again we are tying up that if a case of child marriage happens, then all the other factors, all the other issues, child protection issues for that child that is going to be born is much higher, is so much more higher, and therefore to prevent it at that level itself. So that is something that I think we at CRY are trying to work on, to focus on prevention as much as possible. While there is a need for when an issue happens to respond, response is one thing, but then when we prevent it, then the sustainability is also there. We make sure that the next generation again doesn't fall prey to these same issues as well. So these are certain factors that we are working on. And just to do, if I have the time, can I just go ahead a little more? I thought I'll just give you an example of how we've seen access to education actually support in bringing down child marriage.
Yes,
Yeah,
ma'am. Yes, ma'am. We would
thank
love
you.
to hear it.
Yeah, so we had this village in Karnataka. So in Karnataka, if we looked at it, child marriage again. If you all must have already known, you're working. Karnataka is also another one of the states which is quite low in many of these social indicators. And here, what happened was we saw that in the district of Belgaum. Um, there are a few villages where the school was far off. Children had to travel more than 10 kilometers to access the high school. So up to 8th standard again here was perfectly fine. But then if you had to move up to 9th standard, then 10 kilometers is not a small thing, even for us to be traveling up and down. So you can imagine in such remote and rural places for young children to be able to, go there, you have to change so many buses and go. So all of that was an issue. And here there was a high incidence of dropout, child labor, and child marriage. And we saw that every year. So this is a group of villages in that particular district. Every year in those around 4 to 5 villages itself, more than 60 child marriages would happen. So that was the status, and the partner who was working there with CRY, we were trying so hard to somehow get a school sanctioned there. And after more than 5 or 6 years of working closely with the community, with the government there, we were able to get a high school. And once, in fact, it was the existing primary school which was upgraded to a high school up to 10th standard. And once the school was opened, it was just an immediate shift where there was 100% retention and transition, where all the children who completed 8 just naturally moved on to 9th standard. And in just 1 year, the number of child marriages from a previous year of 64 came down to 6. So I think this was something that is it's like a very clear evidence based case study for us, where we saw live that, and we are continuing to see as well, that when the access to education is provided, automatically there are so many other protection issues that get prevented as well. And because the school itself becomes like a safe space. So parents are not worried when their children are in school. But however, if they have to leave the child at home all alone and go, or to travel so far, then their own the protection issues, their safety, the worry for their well-being also comes into play. And therefore, we are working in all the pockets where we have identified that the even before going to the case of child marriage, if you even just identify that there are a huge number of dropouts, then to start working to make sure that there is a government's action for a school close by, so that then we start preventing child marriage and child labor as well. Thank you, Anadi. If there are any more questions, please do. I think you're on mute.
Yes, ma'am. Sorry, ma'am.
Yeah.
Ma'am, since majority of people are students here, I would like to ask, as a students, how can we help in the area of child rights awareness, and what are the measures that we can take to help in this area?
Yeah, thank you. Yeah, so I think students are the ones that have huge potential when it comes to addressing any, in fact, any issue, any social issue for that matter. And in the same way, when it comes to child rights issue, I think there are a number of ways that you can do this. The options are actually limitless. A few ways in which you can do is, of course, to spread the word firstly, because we have seen that there is a lot of misconception that there are certain of these issues which do not exist, or which were there maybe 20 years back, not now. Now everything is improved, it's all going well. So that is a misconception that is there all around, we've seen. And therefore, to spread the word itself, that to watch out for these, that to so when these issues start getting talked a lot more, then automatically, the instances also come down. But when there is so much of quiet around it, and today especially, I wanted to talk only about most issues that are affecting girl children, which is automatically coming from a very equality or equity principle as well. And therefore, when we start talking about these issues itself, about the value that is placed on a girl child, then the rights issues, the protection issues that girl children are facing will also dramatically come down. And when I say start talking about it, students, I think these days you are in so many spaces. So be it in your own physical space within where you talk to each other, to your own family members, or you're going to be placed in different companies as well once you just finish your education and you move in, where you take this with you, so that when you are in those places, you are in a position then to support as well, to support organizations, to support communities. It's not that you have to support only through a particular manner, but to support also, and in your social media spaces, because that is a huge space now. There are so many social media platforms, so many discussions going on, and to bring life to real issues in these spaces is extremely important. And that is something, if you can do, that will be amazing. The other one is also volunteering. Volunteering is again a huge, and when we say volunteering, it is not, because automatically anything that comes from an NGO is also seen from a very financial point of view sometimes. While there are those who can donate, that is definitely a welcome move, which can help and support children access their education, or keep them away from malnutrition, things like that. At the same time, you can also volunteer with your time. So that is something, especially in CRY, we do have a strong volunteer wing, where that we get so many volunteers, so many students who come and volunteer with us, who intern with us actually. And while volunteering may not, you may think that it's just something that I'm coming for, for a while, just to build up my own resume or something like that. But then it makes a lot of difference. So when you come into that space, when you start working on it, and there are so many different ways of volunteering. It is not just going directly to the community and starting to give awareness. It's not just that, but even something that you sit in your own space and do a small preparation of an IEC material to bring about awareness, and then publicize it, or to get involved in a small survey in some kind of data analysis, to bring out evidence-based studies. There are so many ways of volunteering, that can also help in this issue. So these are certain ways which, as students, firstly, to be conscious of, because I think sometimes to be connected to the reality that is so right in front of us in a country like ours, when we talk so much about development, especially, I think this is one area that we should not ignore. So to be aware of it, to be conscious of it, and also to talk about it and spread the news, I think is the way to go.
Thank you so much, ma'am. We'll surely keep that in mind. At last, I would like to know your experience at CRY. How does it feel to help so many people?
Yeah, thank you. Thanks, Anadi. Yeah, I think so. My experience with CRY has been something else altogether. So I've been with CRY for the past 8 years now, and so I started with CRY as I'm part of the program team in CRY, and so I started in CRY working in just Tamil Nadu, in a few districts in Tamil Nadu, and right now I've moved to a national level where I'm handling the monitoring and evaluation, so all the data of at the national level, actually. And the experience, if you see, has been quite illuminating, because to see that there are so many issues which are still not even being talked about, firstly, I think was a huge eye opener even for me. And then to be able to know that whatever you do, it does make a change in some way. You may not be able to see it in a single day. There's so much of work. Actually, I think the founder of CRY, Ripan Kapoor, one of his quotes is that what I can do, I must do. So that is something, I think, that the kind of stuck with us. We also have those all in our walls. And also one more thing is that the work that we do is difficult, but knowing who we do it for, that is what is the change, actually. So I think that is what has actually kept me going every time when we go on our field visits, when we go and interact with the community members, with the children, see the change that it has made. That is just that it makes you realize that when an opportunity is given, then anyone can perform. So it is not to do that, there are certain people who are not doing something, but then it's just that the provision of the opportunities for everyone equally. So I have been working with CRY in the space of data, actually, interestingly, where I'm able to in the way of conducting so many studies, researchers able to see over a time the change that is coming in. So right from before we have entered in and started our programs, and then to see the impact of the programs really come to life, and to see children who have moved on to such high levels. I think that has been my personal experience working with CRY, and it has made me grow. The kind of things that you learn from the community, it's not a I think what CRY has taught us especially is that it is not a donor organization that you are supporting the community or the projects, but then it is a two-way, it is a facilitation, it is a learning that happens both ways all the time, and therefore we are beneficiaries in that sense. That has I think been a wonderful experience for me, and therefore I love, enjoy working with CRY. And I would really encourage each and every one of you. I know there are so many of you here today, to also in some way relate to, be it CRY or any other organization that is connected to the ground, to work on such issues as well.
Thank you so much, ma'am,
Thank you.
for this session on child rights awareness and motivating us. Today, we got to learn so much from you, and it was an immense pleasure to have you with us. Now, I request the audience to put their feedback, reactions, and questions that you want to ask Jenishiya, ma'am, in the chat box.
Thank you.
You all can ask the questions through chat box. So the question is, ma'am, what is the state of child labor in India? And
It's okay.
Am I audible?
yes, ma'am, you are.
Okay, okay. Just give me a
Yes, ma'am.
minute. So the question was about child labor.
Yes, ma'am.
Okay, what is the status of child labor in India and South India, and in how and CRY you are working towards resolving this issue? The child labor, if you look at it, so one thing actually before going into the issue itself is that unfortunately in our country, the data on child protection issues is quite, the reporting or it's quite low. So there is actually very, you have to depend on very, erratic or random sources here and there actually. And when it comes to child labor, again, we are still dependent on the census 2011 to be, for the child labor numbers. And if you look at it, if you look at the 2011 data, we have almost 4% of the total child population, which is over 4 million children who are, child laborers in the age group. Sorry, that was a wrong number. 10 million. 10 million. Yeah, 10 million in the 5 to 14 years age group. So in the 5 to 14 years age group, you have 10 million children who are working. And of this, you have 4.5 million who are girls. However, if you also look at to just look at a supportive kind of a data base, which is children who are reported as neither working nor nor going to any educational institution. Here, if you look at it, then you again have a 4.6 million girls who are not in the workforce, also not going to schools. So this is a huge number. This is the status of child labor if you look at it. And it is a similar situation in the South Indian states as well, in the places that we are working. If you look at it and CRY, in the last year alone, we have managed to rescue almost 2,460 children just in the last year. So that is again a huge number. And like I again said, the child labor area itself in our country is a little different space, because the Child Labor Prohibition and Regulation Act, the amendment that came recently, says that those in the age group of 15 to 18 years can work except for hazardous labors. And also there is again a situation where working in the family space is allowed. So, and unfortunately, if you look at it, majority of our country is hugely dependent on agriculture, and therefore the major population, rural population, works in agriculture. And so there are so many children who are involved in that as well. Unfortunately, all these numbers do not get reported as child labor at all. So here again, there is a huge underreporting, while the reported number itself is so huge. And you not only have full-time child laborers, but you also have children who are going to school and then Saturday, Sundays working in order to support the family. And here, this issue again we see strongly is when families are not able to support themselves. Again, a very socio-economic status over here. And therefore we also work with the communities to link them to existing government schemes. So that is something that in CRY we've been working on and trying to do, where we link children to educational scholarships. You have pre-metric, post-metric scholarships, and also to connect families as well, to ensure that the families that we work with have ration cards, so that they can have access to the PDS system and get their ration every month, and also connect them to the MNREGA, where from that they at least get that 100 days labor and the work from that, especially during the time when there is migration. Because when you're dependent on agriculture, there is always a period of time when you do not get any income. And most of our people are not owners of the land, but then you are laborers in someone else's land. And therefore when that income is not coming, and then again that itself, children also then start going to other forms of work in order to support the family. So we are trying to work very closely with the government, to one, with the labor department itself, to make sure that all employers know that you are not allowed to engage or employ children, and for them to reveal their books. It is in the CLPRA itself that the register should maintain the age of all children. So to work in that space, also awareness generally in the regular areas where children usually work in shops, small tea shops even sometimes. So even in those areas, to make sure that the information goes out that child labor is a punishable offense. And also, like I said, the most important thing is to work with the social welfare department, with the panchayats, and to link children to the schemes that are available, so that they do not drop out and continue their education. So that is one, and I think there are a whole lot of other questions as well.
Yes, ma'am. So the next question is, working on child rights is a great initiative, but how do we change the mindset of people following the same practices generation after generation?
Yeah. So that's a great question. Thank you so much for that. It is again, like I think I had already pointed out, it's not something that you can see change in even in a year, or sometimes even in 5 years or 10 years. It is not an easy change, especially when you work towards ensuring change in the whole generational behaviors usually. And there are many practices that have been carried over generation to generation. And we feel, especially at CRY, that education is the most important tool for that, for change, while everything else will be a complementary one. But to ensure that education is something that every child can access, and not just to read and to write, not just at a literate level, but to ensure that you move from up to high school, up to go to even college. Only then this mindsets change, because then you also have a whole different range of options where your level of employability itself changes. It is no more that you're breaking that chain right there, that you're not going to be an agricultural laborer. However, you are going to maybe be an owner, or you're going to be a business creator, you're going to work in other spaces. And therefore, that is how we are looking at bringing about that change, while on a regular basis, working closely with the community to help them understand to what are the detrimental effects of each issue. Like we talked about, especially the main issues like child marriage or female feticide. These are very sensitive things, like, rightly pointed out, generation after generation, certain things have been followed. Now, suddenly for them to, for people to accept that this is something that I have to change, it's not easy. And there are so many factors, like we said, it is not that someone wants to do that. It is not that parents want to push their children into marriage, but it is because of so many other issues that is out of their control, right? So, and therefore, to make sure that we work very closely with the government, hand in hand with the government, to ensure that the state provides all of the needs for the community, so that you don't have to depend on, you don't have to depend on your children having to work, or you don't have to, you understand that, girls are also given as much importance as boys. I think that is how we are working at bringing change to. Also, I think one interesting thing that I have seen in my time with CRY that we are also trying is to work with change makers at the ground level itself, where we have seen one or two children in a community, for example, who have finished 12th standard, who have moved to colleges on scholarships itself, who have been able to take professional courses, who have now become, engineers, or working in colleges, or as lawyers, bringing them back into the community to be a source of encouragement and motivation to other children and to their parents as well. That, you can see the difference, that once this girl has studied, when she's moved out, these are all the options that are there for her. And that she's not just, that it is not just the men who bring value to the family, but the women as well. So those kinds of role models, change makers within the community, is one thing that, seeing that, then there is again a mindset change as well. So yeah, that is these are a few ways that we work on that.
Yes, ma'am. So
Yeah.
the last question is, can you share a story where you felt that what you are doing is complete worth the efforts?
Oh, yes, definitely. So I think we've seen many stories actually like this. I think one story that I would like to talk about is one of the girls that we worked in Chennai, basically. So for many years, I think it's just been 8 years since I came in, but I think CRY was working with this one particular child for more than 12 years itself. And we saw that. So this is a very interesting project in Chennai, in Vyasarpadi slums, where CRY is working with a project called SC Stets. And this particular organization works using sports for change. So they focus on especially football, and work with both girls and boys equally to train them on football. And there are many from that area who have become players at district level, state level, national level. There are so many national level players even who are playing there, who are trained by professional coaches over there. So that is a system which we are working in that organization itself to make sure that children are going regularly to school. So once you get them into the sports area, then it is easier for us to track them also, to make sure that they're not dropping out of school. So and every child loves to play. So it is not the focus is not on competitive sports, but sports as a model for change itself, so that children come in here and their energies are actually channelized positively. So we had one such girl who was with us. Her name is Martal, who she also joined this football team. And she was there are so many family issues actually with all of these children, where there is a single parent who is supporting the family, or parents are sick and children themselves have to work. So in these situations they come to join the football practice. And here we work with them, make sure that they go to school regularly, handhold and support them, show them the different opportunities that are there. And so this girl, interestingly, she appeared for the IAS prelims and passed. So that was a huge success for us, that she was the first in all of our intervention area direct beneficiary children. While there are so many who have been able to move from the regular arts and science courses to professional courses, but then for her to be able to crack the IAS prelims was a huge huge achievement. And that gives you a sense of pride, and that word that okay, so her life has definitely changed, and there are children who are watching her. So when you go into this particular area, when you ask children, when you ask girls especially, who is your role model, instead of talking about people that they've read about, they actually tell her name. They all say that we want to be like Martha Akka. So that is a huge thing, that and there are many stories like that, but I think that is one story that kind of sticks with me.
Thank you, ma'am. It was indeed a very heart-touching story. Thank you so much for being here, ma'am. We got to learn so much today, and it was a pleasure to have you with us. Uh, so after the session ends, there will be a quiz related to the session on our social media handle, and the winner will be awarded with special prizes. This was only the sixth session. We have a very interesting session tomorrow morning on yoga by Aparna Pathak. We would love to see you there. The Zoom link will be the same for all the health short session. In case you have any specific queries, you can contact our student hosts Shubhangi, Purvang, and Mohit. Then their numbers are in the chat box. Post Kanyathon, there will be a newsletter where you can read more about child rights awareness and Jenishiya ma'am. With this, I end the session. Looking forward to seeing you all again tomorrow morning. Thank you and bye. Thank you so much,
Thank you so
ma'am.
much. Thank you all.
Thank you so much, ma'am.